So for this assignment, I'm going to be doing one scenario of a medical assistant and a patient. I'm going to be playing the medical assistant, and I'm going to do two different sections to offer two different possible outcomes to the scenario. Hi, my name is Kalani Vyas, and I'm going to be your medical assistant today.
Nice to meet you.
Nice to meet you too, and you are Miss Amy Smith, right?
Yep, that's correct.
Okay, well, Miss Smith, can I verify some of your private information? Could you please tell me your date of birth?
January 1st, 2000.
Okay, and is there any prior medical information that we need to know?
Nothing as of right now.
Okay, good. And what are you here for today?
I'm here for suture removal.
Okay, and your last appointment was a month ago?
Yep.
Okay, well, I will be doing your suture removal if that is all right with you.
Wouldn't a doctor be doing it usually?
Well, removing sutures is actually something that I have been trained to do. According to the American Association of Medical Assistants, I have the proper training because I have the certification that I can remove sutures, and it is completely within my scope of practice, but I'd be more than happy to get a doctor for you if you'd rather a doctor come in.
Well, if you're trained to do so, then I believe you can do it.
Okay, thank you. Well, let's get started. It's going to be quick and painless.
Perfect, thank you.
Section 2. Hi, I'm Kalani Vyas, and I'm going to be your medical assistant today.
Hello?
Hello, and you are Miss Amy Smith, right?
Yep.
Okay, well, Miss Smith, can I verify some of your private information?
Go ahead.
What is your date of birth?
January 1st, 2000.
Okay, and is there any prior health information you want us to know?
No.
Okay, and what are you here for today?
I'm here for suture removal.
Okay, well, I'm going to be doing your suture removal today if that is okay with you.
Wouldn't a doctor be doing that?
Actually, that's something that I can do, so I think I'll be fine doing it, if that's okay with you.
Actually, no, it's not. I believe a doctor should do it. I don't think you were trained enough to do it.
Okay, well, according to the amendment 5.4.10.1, patients do have a right to deny medical care. So since you do not want to have the procedure done by me, I will have to go get a doctor. So I will get a doctor for you. Is that all right with you?
Perfect, go and grab a doctor.
Okay, thank you. So the two scenarios I did, the two sections that I did played out differently because I believe in the first one, I explained what, as a medical assistant, my scope of practice was better to the patient, so they were able to see that I do in fact have the training, versus in the second situation, I didn't explain that I do have the training in order to do a suture. I just said that I can do it, so that probably made the patient a little bit more nervous about whether this is something that I actually am allowed to do or if I'm just saying that I can do it. And I do believe that in real life I could get the outcome that I want, which is that a patient will listen to me, and I think that's because patients do often trust the medical facilities that they go to. So if there's a person that comes in and tells them their title, they do believe that what they're doing is within their scope of practice. And so the scenario shows that the patient technically does have more power, because a patient can decide what they do and don't want done by a specialist, but the truth is that people often don't know how much power the patient holds. So when somebody does go to the hospital, they think that they can't really say anything to the professional because they are professionals, they know what they're doing, so they should just listen to them. So in the second scenario, the patient does tell somebody that they perceive to be somebody with a little bit more power that they don't want this procedure done, and it does end up working out in their favor in that scenario. And versus in the first where they did listen, But I do believe that's also partially because in one they were explained more of scope of practice versus in the other they weren't.